Hello everyone. Today we are moving to second part of clinical assessment of nutritional disorders. In this case of anemia, we can identify the disease by their physiological signs like pallor of conjunctiva by looking their eyelids and pallor of tongue. Tongue become a pale in color and pale of soft palate. And of course, their hemoglobin level should be will be low and then, in severe cases of anemia, their nail shows in a spoon shaped. That is called by koilonychia. And often they have swelling of feet in severe cases of anemia. Next, we can see iodine deficiency disorders, IDD. IDD is a spectrum of disorders in a different physiological stages. We know that. So we can see some of the clinical features we can identify. The main thing is enlarged thyroid. That is the shows in this picture around the neck. We can see that enlargement of thyroid gland. It is called by goiter. Okay, and also we can see that abortions in case of pregnancy, congenital disorders if they have IDD in uh, prenatal periods. So if prenatal period mother have IDD, then the fetus should be congenital abnormalities. And in this, is this in case of childhood, they should have cretinism. Cretinism symptomatic with mental disorders like that. Iron deficiency during pregnancy affects fetal brain development, and so use iodized salt to prevent the iodine deficiency disorders. Next, if we can move into white B complex deficiencies. First, vitamin B2, that is riboflavin deficiency. Total oral cavity is the most commonly affected site in this case of these vitamins. There are three symptoms. First one is angular stomatitis. We see these cracks on the corners of mouth. Next one is glossitis. The bright colored um, magenta colored tongue is the symptoms of glossitis. Next one is sclerosis. That is cracked lips and fissures in the lips are seen. Next, we move into vitamin C, niacin deficiency, that is vitamin B3 deficiency. It is called by Peleta. We know that it is a 4Ds disease. 4Ds means first one is dermatitis, second one diarrhea, third one dementia, and fourth one is death. That is 4Ds. And dermatitis is the main factor we can identify by physiological signs. That is, we can see the burning of like a burning. Uh, on the neck region and the eyes and hands and feet and face also. This is called by causal necklace. In this dermatitis around the neck, just seen like necklace shape. That is this is affected by sun exposure. So and also symmetrical skin lesions are also seen in this dermatitis case. Next one is vitamin C deficiency. It is called as a scurvy. So the main symptom of scurvy is we know that bleeding comes, that is spongy looking bleeding comes. It is gum is bleeded by a simple touch even. And gum swelling is also seen. Petechial hemorrhage are also seen in severe cases like this image. And ecchymosis is also seen. Next one is rickets, that is vitamin D deficiency. Rickets is seen in among children. Clinical features of rickets are bleeding of ribs, like on the ribs we can see some swellings like beads, and patent chest also seen in this case, and frontal boozing, bow legs or knock knees, and delayed closure of fontanelle on the head. A vitamin D deficiency affects bone mineralization in children, so sunlight exposure is important for prevention of rickets. Next, we can see the essential fatty acid deficiency. The term for the disease seen in skin is called a phrenoderma. Since essential fatty acid mainly affects skin, the symptom shows is phrenoderma. Called by the term used for that is phrenoderma. The symptoms of phrenodermas are hyperkeratotic skin lesions. The skin look like a toad skin, like a rough seen as a rough and commonly seen over elbows, knees, and sides of this body. Sometimes skin may becomes dry and rough. Maybe another reason. So in this severe cases is seen in essential fatty acid. It maybe usually improves after dietary corrections. Next, we can move into fluorosis. Fluorosis is the cause of excess fluoride intake. That is the fluorosis, toxicity of fluorine. So clinical features include dental fluorosis and also skeletal fluorosis. In case of dental fluorosis, that can be seen as a mottled teeth, that is yellowishing in teeth, a chalky white patches on teeth, brown stains, and a pitting of enamel, like that. This that is shows in this picture. And skeletal fluorosis means bone deformities, that is joint stiffness, and become in severe cases the patients cannot properly walk. Next is this is a summary table of deficiency disease and sign. And we can find it out by looking patient's body. Kwashiorkor is the deficiency of protein. The sign is edema. Marasmus is the deficiency of both the protein and energy. The sign is severe wasting. And vitamin A sign is night blindness. Iron sign is pallor. Pallor means on the eyelids and tongue and also inner palate. Iodine deficiency sign is goiter, that is enlarged thyroid gland. Riboflavin deficiency is ankylosing stomatitis and also glossitis, chelosis. Niacin deficiency is dermatitis on the sun exposed area. Vitamin D deficiency is bolus or knee legs. And also we can include peach in chest, bearded ribs, like that. Essential fatty acid sign is phrenoderma. Phrenoderma means skin hyperkeratomalaysia. And also we can add vitamin C deficiency sign is bleeding gums and pitachia. And also fluorosis, that is toxicity of fluorine. And deficiency sign, toxicity sign is mottled teeth. This can be included in your studies. And thank you. This is all about the clinical science or physiological clinical assessment of nutritional assessment.